This is a review of landmark papers on umbilical hernia from the East Landmark Papers online resource. Many papers have been written on mesh versus suture repair with larger hernia defects, but little evidence exists on whether or not mesh repair would be beneficial in smaller umbilical hernias measuring 1 to 4 centimeters. In this study, the authors attempted to investigate the use of mesh in these smaller defects. A randomized, double-blind, controlled, multi-center trial in 12 hospitals, 9 in the Netherlands, 2 in Germany, and 1 in Italy, was undertaken. Adults greater than 18 years of age with a primary umbilical hernia measuring 1 to 4 centimeters were randomly assigned intraoperatively to either suture or mesh repair. All surgeons underwent training to use the same technique for both types of repair. Patients then underwent physical exams at 2, 3, and 12 weeks and at 24 to 30 months after the operation. If there was any doubt about recurrence, an abdominal ultrasound was performed. 150 patients were assigned to each group. There were fewer recurrences in the mesh group. The most common postoperative complications were seroma, hematoma, and wound infection, with fewer complications occurring in the suture repair only group compared to the mesh group. In summary, this is one of the few studies showing decreased recurrence in patients with smaller hernia defects that were repaired using mesh, although this should be balanced with other reported complications.